The Tennessee Pledge is a plan to help Tennesseans return to work in a safe environment. Do these guidelines apply to my business? The state is recommending protocols for all businesses in Tennessee, including those that are reopening and those essential businesses that remained open during the Safer at Home order. What steps should employers take to implement Tennessee Pledge guidelines? Allow employees to work from home as much as possible. Screen all employees reporting to work for COVID-19 symptoms with the following questions. Have you been in close contact with a confirmed case of COVID-19 within the past 14 days? Are you experiencing a cough, shortness of breath, or sore throat? Have you had a fever in the last 48 hours? Have you had new loss of taste or smell, or any other symptoms? Screen and temperature check employees. Normal temperatures should not exceed 100.4 degrees Fahrenheit. Ask employees who exhibit COVID-19 symptoms to leave immediately and seek medical care and/or COVID-19 testing. Implement workplace cleaning and disinfection practices with regular sanitization at least every 2 hours. Provide training on personal protective equipment based on CDC guidelines. Provide a sanitizing station, such as a wash basin with soap and/or bottle of hand sanitizer. Prohibit congregating in break rooms or common areas, and limit capacity of such areas to allow for a safe social distancing minimum of 6 feet whenever possible. Stagger shifts, breaks, and meals in compliance with wage and hour laws and regulations to maintain social distancing. Mitigate exposure in the workplace by practicing social distancing and modify scheduling. Plan for potential COVID-19 cases and work with local health department officials when needed. Post signage on health policies to help educate building occupants on COVID-19 best practices.
What steps should employees take to implement Tennessee Pledge guidelines? Stay home when feeling ill, when exposed to COVID-19, or if diagnosed with a confirmed case of COVID-19. Increase hygiene practices by washing hands more frequently. Avoid touching your face. Cover your mouth with your elbow when coughing or sneezing. Have dedicated face coverings worn by all employees at all times. Face coverings should not be an N95 or medical mask, which should be reserved for healthcare workers.
What consumer protection should be taken to implement the Tennessee Pledge? Practice recommended social distancing to the greatest extent possible. Further is safer. Limit the number of customers inside a store at a given time if appropriate spacing cannot be maintained. Strongly encourage customers to wear face coverings inside the store. Consider dedicated shopping hours or appointment times for the elderly, medically vulnerable, and healthcare workers. Establish one-way aisles and traffic patterns for social distancing. Increase curbside, pickup, and delivery service options. Assign dedicated staff to prompt customers regarding the importance of social distancing. Add social distancing reminder signs, personal stickers, floor decals, and audio announcements.
What business process adaptations should be made to implement the Tennessee Pledge? Sanitizing shared resources, such as carts after each use, and sanitizing all high-traffic, high-touch areas such as counters, checkout lanes, keypads, break rooms, dressing rooms, and restrooms every 2 hours and when visibly dirty. Using a clearly designated entrance and a separate clearly designated exit to maintain social distancing. Using plastic shields or barriers between customers and clerks at service counters and cleaning them frequently. Adjusting store hours to allow time for enhanced cleaning. Prohibiting the use of reusable bags. Limiting self-service options and suspending sampling of food and personal hygiene products. Tasking management-level employees to monitor compliance within a store.
For more information about the Tennessee Pledge and industry-specific guidance, please visit tnpledge.com.